Welcome to NCLEX RNPN Study Guide. Let's begin. Question 1. A client with increased intracranial pressure, ICP, is being monitored. Which finding requires immediate intervention? Here are your options. Option A. Pupils equal and reactive. Option B. Systolic blood pressure 150 mmHg. Option C. Respiratory rate 10 breaths per minute. Option D. Glasgow Coma Scale score decreases from 14 to 10. The correct answer is option D. Glasgow Coma Scale score decreases from 14 to 10. Explanation. A decreasing GCS score indicates worsening neurologic status and possible rising ICP. Question 2. Which medication is an osmotic diuretic commonly used to reduce intracranial pressure? Here are your options. Option A. Aspirin. Option B. Mannitol. Option C. Lisinopril. Option D. Ibuprofen. The correct answer is option B. Mannitol. Explanation. Mannitol increases serum osmolality and draws fluid from the brain tissue into the vascular space, reducing ICP. Question 3. What is the normal resting heart rate for an adult? Here are your options. Option A. 40 to 60 bpm. Option B. 60 to 100 bpm. Option C. 100 to 120 bpm. Option D. 120 to 140 bpm. The correct answer is option B. 60 to 100 bpm. Explanation. A normal resting heart rate for adults ranges from 60 to 100 beats per minute. Question 4. Which of the following is a sign of hypoglycemia? Here are your options. Option A. Dry skin. Option B. Fruity breath. Option C. Sweating and tremors. Option D. Deep, rapid breathing. The correct answer is option C. Sweating and tremors. Explanation. Sweating, tremors, and tachycardia are common signs of hypoglycemia. Question 5. Where is the apical pulse located? Here are your options. Option A. Neck. Option B. Wrist. Option C. Groin. Option D. Left side of the chest. The correct answer is option D. Left side of the chest. Explanation. The apical pulse is found at the apex of the heart, on the left side of the chest. Question 6. What does CPR stand for? Here are your options. Option A. Cardiopulmonary resuscitation. Option B. Cardio pulse rescue. Option C. Coronary pulmonary response. Option D. Cardiac pulse rate. The correct answer is option A. Cardiopulmonary resuscitation. Explanation. Cardiopulmonary resuscitation is an emergency life-saving procedure. Question 7. Which route of medication administration provides the fastest absorption? Here are your options. Option A. Oral. Option B. Intramuscular. Option C. Subcutaneous. Option D. Intravenous. The correct answer is option D. Intravenous. Explanation. For medications go directly into the bloodstream, providing immediate effects. Question 8. What is hypertension? Here are your options. Option A. Low blood pressure. Option B. High blood pressure. Option C. High blood sugar. Option D. Low blood sugar. The correct answer is option B. High blood pressure. Explanation. Hypertension is the medical term for high blood pressure. Question 9. Which organ produces insulin? Here are your options. Option A. Liver. Option B. Stomach. Option C. Pancreas. Option D. Kidneys. The correct answer is option C. Pancreas. Explanation. The pancreas contains beta cells that produce insulin. Question 10. What is the universal blood donor type? Here are your options. Option A. A positive. Option B. AB positive. Option C. O negative. Option D. B negative. The correct answer is option C. O negative. Explanation. O negative blood can be transfused to patients of all blood types in emergencies. Question 11. What is a common side effect of opioid analgesics? Here are your options. Option A. Diarrhea. Option B. Constipation. Option C. tachycardia. Option D, hypertension. The correct answer is option B, constipation. Explanation: opioids commonly decrease gastrointestinal motility, leading to constipation. Question 12. Which nutrient is primarily responsible for tissue repair? Here are your options. Option A, carbohydrates. Option B, fats. Option C, proteins. Option D, vitamins. The correct answer is option C, proteins. Explanation: proteins provide the essential amino acids needed for tissue building and repair. Question 13. What does NPO mean in medical terms? Here are your options. Option A, nothing per oral. Option B, new patient order. Option C, next patient out. Option D, nightly pill only. The correct answer is option A, nothing per oral. Explanation: NPO stands for nil per os, meaning nothing by mouth. Question 14. Which tool is used to measure blood pressure? Here are your options. Option A, thermometer. Option B, stethoscope. Option C, sphygmomanometer. Option D, otoscope. The correct answer is option C, sphygmomanometer. Explanation: a sphygmomanometer is the instrument used to measure blood pressure. Question 15. What is the primary function of the respiratory system? Here are your options. Option A, pump blood. Option B, digest food. Option C, exchange of oxygen and carbon dioxide. Option D, filter blood. The correct answer is option C, exchange of oxygen and carbon dioxide. Explanation: the lungs facilitate gas exchange between the body and the environment. Question 16. Which condition is characterized by inflammation of the joints? Here are your options. Option A, osteoporosis. Option B, arthritis. Option C, scoliosis. Option D, fibromyalgia. The correct answer is option B, arthritis. Explanation: arthritis causes joint inflammation, pain, and stiffness. Question 17. What does a high white blood cell count typically indicate? Here are your options. Option A, anemia. Option B, infection. Option C, dehydration. Option D, clotting disorder. The correct answer is option B, infection. Explanation: an elevated WBC count, leukocytosis, is often a sign of infection or inflammation. Question 18. Which is a sterile procedure? Here are your options. Option A, taking a blood pressure. Option B, inserting an indwelling urinary catheter. Option C, administering oral medication. Option D, bathing a patient. The correct answer is option B, inserting an indwelling urinary catheter. Explanation: catheter insertion requires sterile technique to prevent urinary tract infections. Question 19. What is considered a normal body temperature in Celsius? Here are your options. Option A, 35°C. Option B, 37°C. Option C, 39°C. Option D, 40°C. The correct answer is option B, 37°C. Explanation: normal human body temperature is approximately 37 degrees Celsius, 98.6 F. Question 20. Which of these is a priority in any emergency? Here are your options. Option A, checking medical history. Option B, airway, breathing, circulation. Option C, calling the family. Option D, administering pain medication. The correct answer is option B, airway, breathing, circulation. Explanation: the ABCs are the fundamental priorities in emergency medical assessment and treatment.